All right, Chapter 13, Difficulties Inherent in the Health Professional. All right, so our objectives are identify 3 possible sources of difficulties that create barriers to the health professional, 2 types of difficulty health professional and patient relationships. Did I say that right? 2 types of difficult health professional and patient relationships and showing respect in these difficult situations. So sources of difficulty, we're going to talk about within the health professional, interactions with patients, and within the environment. So within the health professional, we're talking about your personality and how you deal and how it's more of a factor. We all know that we should be non-judgmental, but in fact, it does happen. And if you say that it doesn't, then I'm going to call you out because we have always at times judged. In general, patients who don't accept or appreciate what we do, we typically put them in a category of, quote, bad patients. And that's not always the case. In the book, there's something underlined that says you should be able to function effectively in all patient situations, and you are solely responsible for the success or failure of these interactions. That's a pretty heavy burden. Especially on what you're thinking at the beginning. Again, you should be able to function effectively in all patient situations, and you are solely responsible for the success or failure of these interactions. That's tough to take on as a student, and it's okay if that feels a little heavy. I understand. That feels heavy even 13 years in. So it's okay to feel that way, but you just need to be on the right path, and that's what we're getting you on. All right, so difficulties within the health professional. We've already talked about the transference and countertransference. Take a second to think about what that was in the last few chapters. These can impact both negatively and positively. That can be hard too. If you have someone who's doing some transference on you that's in a negative aspect, that just makes your job a little bit more difficult, but that's something that you're going to have to manage. Personality can play a role. Some people are more laid back than others. Some people are anxious, a little bit more hypersensitive to what you're saying or what you're doing or how you're acting. That can be a source of difficulty as well. Your gut reaction is the most reliable indicator of a negative emotion. Again, your gut reaction is the most reliable indicator of a negative emotion. That feeling that you get in your stomach that something's going to go wrong or something is wrong, that's the most reliable way to tell. Again, we're supposed to be non-judgmental. But indeed, some patients are more likable than others. Some patients feel bad and complain even after everything has been done for them. Some aren't clean. Some don't listen, cooperate. Some break the rules. Some are demanding. They want everything for them right now, and that can be a source of difficulty as well. Difficulty within the interactions with patients. So if we think about what makes a patient undesirable, I'm sure that each one of you could make your own list. The book talks about these specific ones. Demanding, a strain on your time, your patience, your resources. I can think of a few patients just off the top of my head that were testing my patience and hard for me to manage. But you have to make that professional interaction and make sure that you're treating each person appropriately. Some patients want unnecessary medical testing. Some whine or gripe. Attorney intervention, that's challenging too, especially with your workers' comp patients who don't want to get better because of possible attorney intervention. Some are violent, angry, self-harm behavior, non-compliance. There's just a lot that can go into it. Remember, sometimes your non-compliant patients are not non-compliant because they don't want to. They're non-compliant because of something else. So again, make sure that we're looking at the patient from a whole. The environment can be a factor. So if you think about the place where you work, that facility itself can make a patient fearful or angry. They might react that way because they feel that way. If it's a hectic environment, if there's lots of patients, lots of doctors, things are moving fastly, that could increase your anxiety. If a healthcare provider goes into someone's home, that patient might feel anxiety, and that anxiety can transfer onto the healthcare professional. Patients sometimes feel powerless over their care. They're being told what to do, when to do it, all of the time, and there's that powerless feeling. Aesthetics, spacing, crowding, climate. If there's a clinic, which I'm not sure that this would ever happen, but this is like a broad example. If a clinic doesn't have air conditioning, it might be fine in the morning, but by the afternoon, patients might get angry, a little disgruntled because they're getting warm, hot. They might not feel good. They may not want to come because they know it's going to be a hot clinic. Patient behavior is inconsistent with what your patient should be acting like. That can negatively influence. So you can't really use the word bad to describe a patient, but what words could you use? How could you document that? Disruptive, unmotivated, maladaptive, which is basically can't adjust, regressed, manipulative. Those are some words that you could use instead of a bad patient. We as a healthcare professional don't want to resort to negative behaviors ourselves. If we're doing that, it's just going to resort to inappropriate treatment and the patient won't get better. Difficult health professional and patient relationships. There's two main types. There's patients who are self-destructive and patients with violent behavior. So if we think about patients who are self-destructive, an example of this would be a woman who is beat by her husband but doesn't want to press charges. How frustrating would that be for you? Or they just return back home with them. And you as a healthcare professional knows that that's not a safe environment for your patient. Or patients with violent behaviors, gang members, someone who is in jail or going to jail or violent towards you. My clinic was close to work release, so we had a lot of patients from there, and we had a lot of patients from the Dauphin County Jail come in. And it was nerve-wracking. It was a little bit scary, but we have to treat everyone as if they were the same, even if it makes you nervous. So, showing respect in difficult situations, what can you do? How can you make this better for you in some of these hard, challenging times? Well, set your limits. Understand and be in tune to your own feelings. If you're not feeling great, then step back or ask another clinician. Focusing on the unacceptable behavior. So making sure that you have structure and consistency and you're setting these limits according to that. There are patient care agreements. We're making sure that they agree to the outlines, the expectations, the plans, responsibilities, and of patient and the consequences. Making sure that they're following what they should be doing as well, and treating the clinicians with the respect that the clinicians deserve. There are protections from abuse and harassment, the laws and regulations that are set already. Some general guidelines for showing respect towards a difficult patient. Avoid derogatory labels. Be empathetic and caring is important. Sometimes we think that they're difficult and it's just coming off as something else. Set realistic expectations. Don't expect to change the patient's situation beyond your control. You cannot control a relationship problem at home. You can't fix that, but just helping the patient as much as you can. Take care of your own well-being. Again, we've talked about this before. If you are not healthy, if you are not keeping yourself healthy, you will not be healthy with your patients. So just making yourself aware of that. Ooh, sorry. Professionals we all make mistakes. And that it's okay. It happens, especially at the beginning of your career. I feel like sometimes healthcare professionals feel like they don't ever make mistakes. They're like, well, that wasn't my fault. The blah, 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 blah. Well, no, it was your fault. You just didn't do it right. It's okay to accept your mistakes. we must view these mistakes or errors as a learning opportunity. There's few places where we feel like we can talk freely about them because we feel like something's going to happen. We're going to get sued. We're going to lose our license. We're never going to work again. But make sure that you are also being legal and ethical. And also, just saying you're sorry and admitting to your mistakes can really make a huge difference in your career. I have done it a few times myself. And that's, it really humbles you a lot. No one is perfect. No one is expected to be perfect. So it's okay to admit to it. Thank you guys for listening. If you have any questions, please don't hesitate to ask. Bye.